For more than 40 years, Americans have been arguing over abortion and whether it should be legal. Now, one of the chief battlegrounds is Kansas, where a doctor who provided abortions was shot and killed by anti-abortion activists 2 years ago.
This morning, new laws aimed at limiting abortions in Kansas are adding more fuel to the fire, and correspondent Cynthia Bowers has the story.
See this line now?
Dr. Tracy Nauser checks on a patient in her Kansas office.
You are good, we're done.
The married mother of two who asked not to be identified never dreamed she'd be here.
I found out at 14 weeks that my baby had encephaly. I was told that if I carried my baby to term, that within 5 minutes of being born, that my baby would die, and I would have to watch my baby die.
Her obstetrician suggested Nauser's clinic, one of only 3 clinics in the entire state that still performs abortions, access that could soon be cut even further.
Kansas, in the heart of America, is a culture of life state.
Since taking office in January, Governor Sam Brownback, a staunch abortion opponent, has enacted 3 new laws restricting the procedure. One requires both parents of a minor give notarized consent before any abortion. The second bans private health insurance coverage for most abortions. And the third gives the state's health department broad authority to regulate the operations of abortion providers.
We consider this common sense legislation that almost all Kansas citizens would like to see.
The Supreme Court's landmark Roe v. Wade ruling made abortion legal across the country, but a 1992 ruling allowed states some power to regulate it. Since then, abortion rights advocates allege new laws in dozens of states are intended to drive abortion providers out of business. Earlier this month, Mississippi voters rejected a call to declare a fetus a person. Kansas Senator Mary Pilcher Cook says her state's regulations are solely intended to protect women.
What do you say to people who view these restrictions as a means of kind of outlawing abortion by a side door?
We're protecting women's health and safety. We're making sure that parents make the decisions over their children's health care, and we're making sure that taxpayers are not paying for abortions that they believe are immoral.
Abortion is a medical procedure. It's not a political procedure, but it's being made that by the government.
Dr. Tracy Nauser and her OBGYN dad, Herb Hodes, see it much differently.
What do you think about these new regulations and restrictions?
They're onerous, they're completely unmedical, they're unnecessary.
It's blatantly obvious, and it's death by 1,000 paper cuts.
They fear limiting access to abortion will drive desperate women to illegal clinics or to drugs bought on the internet.
Women are going to have to go back to dying if we don't stop this railroad on women's rights.
A fear now understood by a woman who until recently wasn't sure she supported abortion rights.
It was definitely the most difficult decision that I've ever had to make. And I want people to know that it's not a black and white issue. There's so many gray areas.
Emotionally, you're still doing good.
And she fears it's the women in these gray areas that stand to lose the most if these new laws hold up in the high court. Cynthia Bowers, CBS News, Overland Park, Kansas.